So let's just spend a few seconds, again, being silent and absorbing these beautiful vibrations of deep gratitude, inspiration, and any ideas that really resonate within you from what you have heard. Okay, my dear friends, the next speaker is I'm delighted to say and honored to say, my angelic sister, Aisu, Dr. Aisu Rahman, who is a medical doctor from Bangladesh. That's where we are from. And I'm so proud to say that from the moment she became a medical doctor, she chose to really work with the vulnerable, sex workers, AIDS patients, impoverished women, children. And my sister, her passion, what really splashes in her heart is the joy she feels when she's able to empower women, particularly women and children. So she has really made it her life passion to be of service to impoverished women and children in the villages of Bangladesh by creating these programs of health education, and providing economic opportunities. Dr. Aisu.
Hello, everyone. Assalamu alaikum. Thank you, Bhaiya. Bhaiya is the word brother in Bengali. So as you can see on the screen, the Suraiya Ataur Medical Clinic, it's a neighborhood village clinic, and it provides basic healthcare to women and children in our ancestral home in Bangladesh. So where exactly is Bangladesh? Okay, so on the map, you can see this long stretch over continents and oceans, Seattle to Chandipur, Bangladesh, which is in the north. And it's hard to see the outline because it is a tiny country bordered by India, Myanmar, and the Bay of Bengal. Just to put the 55,000 square miles in perspective, imagine the state of Oregon, half the state of Oregon. That's how big Bangladesh, the country, is. And then think about half the population of the entire US in that area. So Bangladesh is very beautiful, but one of the most densely populated countries in the world. The other, before we go to the next slide, this slide, whenever I see it, makes me feel so grateful, but also gives me the sense of how powerful love, faith is, and when we say neighborhood, it's not just the next door, but it's actually across the oceans from Seattle to Bangladesh that we are helping out each other, and we're family. That's kind of hard to grasp, but on the map, I can see it. So I love this map in many ways. So a very brief background of how Suraiya Ataur Medical Clinic came to being. These are my parents. Suraiya is my mother's name. Ataur is my father's name. They were diplomats, and these are some glimpses of their lives and some pictures with world leaders. They opened a school, girls' school, and the next picture you can see on the top. They opened a school in 1967 in honor and memory of our grandparents or their parents. And my grandparents were, entire life was in service, but their passion was women's empowerment. So the school was for girls. It started as grade 1 to grade 5. And they continued to provide for this school to keep it running. They donated land right next to our home. In early 90s, my parents passed away. And who stepped in? Interfaith Community. So at that time, Karen Lindquist, Jamal, my brother, their family, friends, Everyone would raise money every year and kept the school going. Fast forward to the picture below, in the 2000s, the government of Bangladesh now has taken the responsibility. And you can see that this school is a big building. It's a 2-storied building in that land. And there are women who go from grade 1 to grade 10. And we have been sustainable and doing great work ever since. So again, the power of, neighborly love and commitment. You can see on this screen, on the right is the school, and right next to that is the clinic. So before this clinic started, we at the Interfaith Community Sanctuary had meetings, and then with the courage and the hard work and the dedication, again, Karen Lindquist, Sally Jo, Jamal Friends community, we started a clinic in one of the classrooms actually in January 2014. And a female provider would travel twice a month and provide services to about 60 patients, 60 women and children every month. So again, fast forward that, in 2 years after that, we had our own building. Now we have our own full-time doctor, female doctor on the left, you can see, and a medical assistant. We also have 4 other staff like the receptionist, personal hygienist, the guard, caretaker, because it is a beautiful building. We want to keep take care of it, and a coordinator. So at present, we are open 4 days a week. We see about 200 patients a week. And patients come for menstrual issues, symptoms like pregnancy, which are pregnancy related, respiratory issues, skin issues, abdominal issues, children, babies. And I want to tell you, whenever I've traveled, which is many times, Susan Kingston has traveled, Zahra has traveled, and we always hear one of the things that is common, the patients will say, this is so convenient, this is so empowering because I can decide when I want to go and how I want to go. I don't have to depend on anyone to take me or plan a day or, wait for someone to get a car or a bus or something ready to take me all the way there, me and my child. I have that power. I have that improved quality in life, and I can just walk over. So again, this reminds me very much of what Judy was saying, volunteering that time. We have the school children, we have our neighbors in Chondipur who are sort of giving this information to other women. And now it spread across, I think, at least 6 or 7 other villages nearby. And when I say villages, one village is maybe 6,000 people. So you can imagine that's serving a lot of people through those, word of mouth. And so that's incredible. This is just other glimpses of, of course, we are familiar now, COVID times. So washing their hands, taking the temperature before they go in, and then getting their medication. So I just want to mention $1 equals to 80 taka. We call it taka. And these women, they have to buy a ticket, which is 5 taka. We had decided we don't want, we want, the patient also to have that feeling that I'm also contributing, I'm also paying for something. So they pay 5 taka. So I'll do the maths, it's about 7 cents For in return of the 7 cents, they get medication, they get time alone with the female provider and follow up. And, you know, they can bring in their neighbors, their family. This is their clinic. The women, that's them, you know. Another patient I love, she said, you know, this clinic has improved the quality of my life because I don't have to worry anymore. I know that if there's something and I'm thinking about it, I can just afford to go and show and have that peace of mind. And I think that's the most valuable sort of women's empowerment feeling that you can get. Okay, so just a brief mention that the clinic operations, we spend about $25,000 to give a service to 800 patients. And this includes salaries, medication, and utilities. There are no overheads because of our amazing volunteers here. And I'll show you a picture of them. So just wanted to throw that in. Up on the screen is a picture. On the right and left are my parents. And of course, that's me on the left. In the middle is Tina. She is our scholarship student. So let me go back just a bit. And Zahra is on the right. That's during our visit, I think, in 2019, just before COVID. So when we had talked about to the villagers before we started the clinic and after, what everyone was wanted is, you know, the school is there, your generation has started the clinic. We also want something that, you know, when women graduate from the school, they can go to a field. So like a nursing school, you know, and that's our future. That's our hope. But we, due to thanks to the generosity of people here, we've been able to provide scholarship to this young lady that you can see smiling in the middle. She is now in the second year of nursing school. It's a 4-year program, and the scholarship is going to cover all 4 years. And we're really so honored and happy to say that we were able to raise funds where we can offer another, maybe 1, maybe 2 scholarships actually this year. So we are working towards doing that. And here is our amazing, amazing volunteers all over the world, in Bangladesh, here. And it is really due to them. You can see their smiling faces, but it's also their generous hearts. And if you can picture that behind them or with them are so many other people who are not in the picture, but you can feel their love and their commitment and their leap of faith. So thank you to all for making this work and continuing. And if you want to know more about Suraiya Ataur Medical Clinic and what we envision our women's empowerment program, the scholarship, anything, please feel free to browse to our website. We're very excited because this is the year, actually last year when we started the website. So thank you so much. And shukar alhamdulillah for everything, for neighbors, for love. I am so grateful. And from all of us, thank you for being part of our family.
Thank you, Aisu. Thank you so much. My dear friends, once again, a few seconds of silence to absorb that feeling of gratitude, inspiration, joy, and any ideas that are bubbling up from within you.